Okay, everybody, we are recording now. I am reshooting this video for the third time here because the last time, A, we went into overtime, and B, there was a hardware glitch that caused everything to brown out for a second and come back on. But by that time, I was disconnected from Zoom and everything else. So we are going to do basically Muscle Lab video 7 of 8. Muscles of the thigh. So I'm going to reshoot this video here. And basically, muscles of the lower extremities, set of images, 1 of 2 on the Canvas module. So 2 of 2, of course, is the lower leg. This is basically the thigh, the attachment to the pelvic girdle here. We have the mid-sagittal view of the sacrum up here, a gluteus maximus muscle, a bunch of hamstrings, adductor magnus, gracilis muscle, a whole bunch of muscles here. So as you see on Canvas, what I have posted on these images here, I've just taken photographs of our models that we have in our laboratory rooms from all angles, just like a rotation. And then I took some of the superficial muscles off so we can get a deeper view of what's underneath these superficial muscles. So all this information, all this stuff is available. There's some very devilishly tricky things about the thigh region, the femoral region, in terms of the musculature, just as there are some very tricky things about the forearm, the antebrachium as well. Just the three-dimensional complexity of everything is very, very challenging. Okay, so I'm going to stop share now, and I'm going to go over the muscles as they sort of appear in a word list to a limited degree. Okay, so I was able to score this model cheap enough way back in the early lockdowns. It's kind of like a sort of an off-brand model of, let's see, what we have in our rooms. So what you have here is a posterior view, gluteus maximus, hamstrings, hammies. And then we have the aforementioned, I have a 25-pound dumbbell here, keeping this stand on the table here, because otherwise it'll fall off. Here we go, mid-sagittal view, mid-sagittal cut through the sacrum. Sacral nerves forming a sacral plexus, and then they form one great big giant sciatic nerve. What you see here is the medial view of the thigh area. A lot of tricky, complicated muscles here. This right here, which you are seeing, causes the biggest loss of points, or one of the biggest losses of points on lab practica and quizzes. So we'll spend some time dealing with that. First, before we go dealing with the tricky stuff, let's get some of the easy stuff out of the way here. So I need to rotate this so you have an anterior view. And we shall start with 2 muscles, the psoas major and the iliacus muscle, and how they combine to form this little triangular wedge right here. This little triangular wedge I'm highlighting, called the iliopsoas muscle. Okay, so this iliopsoas muscle, it's 2 muscles. The iliacus and psoas major combine, and they form a single unit. Let me pause. Okay, let's resume our recording here. That's the nice thing about doing pre-recorded sessions instead of live sessions. It took forever to alter the camera tripod and boom and everything else here. Anyway, this psoas major is going to originate on transverse processes and the body of thoracic 12, lumbar 1, lumbar 2, 3, 4, and 5. It's pretty much going to insert, it's going to come down, it's going to join the iliacus, it's going to come down around, and let's see if I dare lift this thing up so we can see the insertion. It'll insert on the greater, I'm sorry, what am I saying, greater? This is the lesser down here, follow this one, lesser trochanter of the femur. Okay, so this model, like I mentioned to you guys before, it was owned by a personal injury attorney who used it as courtroom exhibits. The guy retired, and I got it dirt cheap at his estate sale there. At any rate, and I don't usually mess with estate sales, but if you know, if I know someone or a friend of the family, I might check it out. Anyway, so that's that. And this part right here, this is the iliacus muscle. This is, of course, going to originate on this, say this, basically this iliac fossa, and to a degree, the sacral ala right here. Okay, so what this combined muscle does together, thigh and torso flexion. So when you're going to flex your torso, when you're doing sit-ups and crunches, working out those abs. That's the bad news. You're also going to work out this muscle, which is so deep inside the body, no one's ever going to see how chiseled you got it. Because it's not one of those superficial muscles that gets all defined and toned and makes you look good in a bathing suit and all that. Okay, there's a few other things. If just the right or the left iliopsoas, iliacus psoas major muscle contracts, then we'll have lateral flexion of the vertebral column. You'll bend your back to one side or the other. Okay, so that's it for this rather tricky muscle. And the actual iliopsoas is this part down here. Up here, this is a completely separate muscle, the psoas major, and the iliacus by itself is separate. So really a complex muscle that does multiple different things depending on which part is going to do the contracting. Okay, let's go back to the other view here. So let's pause. Okay, now we're back to recording and our previous image here. So that other model it just showed once again psoas major and iliacus and iliopsoas here in very splendid isolation. Now I need to rotate this so you are viewing this laterally from the side. There we go, get that in the middle of everything. And I need to remove the gluteus maximus muscle. Sorry, fella, got to remove the butt cheeks here because we are on a mission, and that mission is to identify this muscle right here. This muscle has a complicated name, tensor fasciae latae. Tensor tells you what it does. It pulls on stuff, it tensions a cable or of sorts. Fasciae means, oh, this cable, this ligament, this tendon, this mass of connective tissue it pulls on is in the fascia, that it's in between muscles and skin to some degree. Latae tells you, oh, it's lateral on the side or wide. In this case, latae means wide, broad. So let's see if I can pan the camera, actually tilt it down. Pan, you go right to left, tilt, you go up and down. So here we go. This big band of connective tissue here, this big white strip here, this is called the iliotibial tract. So this big band of white material here, dense irregular connective tissue, a ligament of sorts, a tendon in some ways, it's not a muscle. It doesn't generate force, but it transmits the force of many other muscles and also tenses things up, stabilizes things, so these other muscles are capable of doing their work in a more efficient fashion. Okay, so tensor fasciae latae basically tenses, pulls upon the iliotibial tract. Okay, and in so doing that, it's going to basically stabilize your entire torso. It can also flex, abduct, and medially rotate the thigh as a whole. Well, not just thigh, but the lower leg that's attached to it and the foot that's attached to the end of that. Okay, where does this tensor fasciae latae originate? Oh, you totally know this area from the bone practical. Let's see, can we see this? Yes, we can. Right up here, anterior, superior, iliac spine, and then iliac crest. So let's just do a little camera tilt here. We can actually pull this off very carefully. Now, and I had this thing laying on the table flat shooting the video, which was nothing but difficulty because of the light reflection and everything else. This would just fall off and cause me endless annoyance. Well, I'm wasting bandwidth here. There we go. We got a bunch of deep stuff underneath there, like gluteus medius, gluteus minimus muscles. But then again, you can see that iliac crest, anterior iliac spine. And if we rotate that around, we got this little white band here, that inguinal ligament, which I talked about before, but what shows up on this model, and that other one as well. I need to put this back just for now. It'll be coming off soon enough. We need to go to our next group of muscles. Okay, let's go ahead and deal with the quads. So quads pretty much are the most powerful muscles of the human body. And we call them quads. Quad means four. So a quad runner, a little four-wheeled off-road vehicle, as opposed to a trike or one of those old three-wheeled Honda ATVs that made many, many widows back in the early 80s, or a dirt bike, two wheels. So we actually have four muscles in this, hence the term quadriceps femoris group. Okay, so let me just reach over here and pull this off so we can see our fourth. We have 1, 2, 3, and then 4, fourth muscle in here. Okay, so these four muscles are as follows. This right here is the medial side of this part of the body. So this is called the vastus medialis. Okay, so vastus medialis. Where does it originate on? It originates on the linea aspera, medial supracondylar line, and way the heck up here at the distal end of the femur on the intertrochanteric line. Okay, where is it going to ultimately insert? Let me just put everything back here. We're going to follow these quads, all four of them, and tilt that down. So all four of them are coming down to the patella. They have this quadriceps tendon that concentrates all their power on your kneecap muscle. This is what you use to find furniture in the dark when it's 2 o'clock in the morning and you want a glass of orange juice or something, but the kid has their toys all over the floor and you just bash your kneecaps into them. Okay, from the patella, we have the patellar ligament that goes to the tibial tuberosity. So the action of all four of these quadriceps group muscles is kind of similar in that they are the major leg extenders and thigh flexors. So you're running to kick a soccer ball, try to score a goal. When you throw your leg out to kick that ball, you're using your quadriceps femoris group. If you're on an elliptical machine, riding a bicycle, you're going to give your quads a good workout. They can also flex the entire lower extremity at the thigh. Okay, so that's again the vastus medialis. Now, rectus, oops, let's tilt our camera up here. Rectus femoris is the superficial one in the middle. Okay, that one originates at the anterior, inferior iliac spine, and also the margin of the acetabulum, where the head of the femur goes into the joinsias coxa. And this is also going to be, again, a leg extender, thigh flexor. Lateral side of things, right next to our iliotibial tract, and really kind of on either side of it to a limited degree, is the vastus lateralis. That originates on the greater trochanter of the femur, intertrochanteric line, and linea aspera of the femur. Once again, it's going to extend the leg. It's worth mentioning that both vastus medialis and vastus lateralis, together they can stabilize your knee joint, stabilize the patella. We've all watched enough sports on TV to see a soccer player, football player, basketball player take a hit to their lower leg in the wrong way, Sometimes usually it's going to be an accident. If something like that was deliberate, that would be like major sanction on the offending player. They go down and they don't get up, and they don't get up for another 6 months or so because they're out for the season. This knee joint, it's only supposed to bend in one direction. Of course, we talked about the ligaments and everything and the cartilage menisci in here to keep it that way. But if by physical force it bends in the wrong direction, like mine did many years ago, things are busted bad. One of the physical therapy ways of getting around, dealing with that in life, healing process, is get your quads just nuked, because they're going to be helpful in stabilizing everything. Now, when I grew up, I was a little too poor. I mean, I was a kid making $3.35 an hour, $4.25 an hour. That was minimum wage. And the surgery to correct my knee was $20,000. And my parents didn't have that money. Nobody, well, wealthy people had that money, but I sure as hell didn't. So I just lived with it for the rest of my life. And now I'm too old to want to throw the money at it to get it fixed. Okay. Deep inside our fourth quad, the vastus intermedius. Oh yeah, it's intermediate between medial and lateral. Cool name. It's going to originate on the front and side. So we have a fancy word for something on the front and side: anterolateral. And it's going to originate on the anterolateral side of the shaft of the femur up here. And once again, it's going to insert on the quadriceps tendon down here, which goes to the patella. And once again, it's the major leg extender part of that group. Now, I need to put this vastus intermedius back here because we have a tricky devil, several tricky devils coming up here. And we're rotate this around. I kind of need to pull my camera back just a little. This right here, we follow it around. So let's just start with our straight anterior view, pubic symphysis right here. Whoops, wrong camera adjustment. Spinal column, lumbar vertebrae join up here. And this is the side of the hip right here. Okay, so this starts kind of up about where you could say the anterior superior iliac spine is. It's going to wrap around the front, come down, go down on the medial side, keep going all the way past the femur, the distal end of the femur, past the knee joint itself, and it's going to wrap around to the front again down here to actually insert on the tibia. So this muscle is called the sartorius, longest individual single muscle in the human body. If you were to measure the length of each of these with a ruler, a meter stick, tape measure, whatever. So it originates way high up on an anterior superior iliac spine, and it's going to insert down here. Whoops, there we go, tilt down on the medial side of the tibia. What does this long, skinny, high endurance but low strength muscle do? It's going to flex, abduct, and laterally rotate the thigh. So it'll rotate your leg at the thigh, so your feet are pointing outward. It is also a very weak leg flexor. So it'll flex your leg at the knee joint weakly, though. It's not going to be super strong in doing that. Sartorius muscle is one of those that just helps out with the actions of a lot of other muscles. Okay, let's see. Let's go up again and stabilize my camera platform. Actually, let's elevate this. There we go. Damn, platforms is above the level of my head. Just because I have everything else here, I need to be able to move and see. So once again, psoas major, iliacus, iliopsoas is this little triangle. But on the other side of this, the yellow thing, a nerve, the red thing, an artery, the blue thing, a vein. We have this little triangle here that I'm highlighting. This little triangle right here is the pectineus muscle, or pectineus or pectineus. It's going to originate right here on the superior ramus of the pubis, you know, where we're sort of forming the pubic crest. It's going to go down underneath all this stuff, and I can pull the sartorius off. It won't really be helpful because, again, femoral artery, femoral vein, and femoral nerve are kind of obscuring everything in here. At this point, this is no longer the sciatic nerve here, this yellow thing, it's the femoral nerve. Anyway, this pectineus muscle dives underneath those three things, and it goes to the lesser trochanter of the femur and linea aspera. What does this little triangle-shaped muscle do that's peeking out at us here? Well, it's going to adduct, flex, and medially rotate the thigh. And again, it's one of the smaller muscles here. Now, I need to put this sartorius back because we are now going to get to the trickiest part of all of this in terms of where people crash and burn on lab exams. So once again, we have our anterior view of the upper part of the lower extremity, the thigh, got our quads facing forward. We need to rotate this. Now we have a medial view. Okay, I should probably put this butt cheek muscle back in, the glute, because it does provide a frame of reference. Okay, so what do we have here? We have the sartorius here. We have a little bit of vastus medialis and rectus femoris visible laterally. But the really important thing right here is this muscle. I'm going to take it off. This muscle is called the gracilis, as in like it's graceful, so to speak. So that's the gracilis muscle, another one of these thin strap-like muscles with parallel architecture in this part of the body. Where does it originate? Inferior ramus of the pubis and body of the pubis, or pubic bone, which of course is part of a three-part os coxae. It's going to insert like the sartorius. It totally bypasses the femur. It goes along the femur, but it doesn't even attach to it. It's going to insert all the way down on your lower leg bone. Whoops, there we go, on the tibia, below, pretty much below this epicondylar spot on the tibia. Okay, so what does this do? It is a thigh adductor. It'll also flex and medially rotate the leg. Okay, so again, this view right here gets a lot of people. You may, if you see this on a lab practicum, first of all, cross-sectional mid-sagittal cut of the sacrum and first lumbar vertebrae, dead giveaway medial view. But if you just get an image like this, without this hint, this big hint cluing you in what you're looking at, things will be a little bit more tricky. In real life, where we'd have all these actual specimens set up in a room, you know, you have all your visual cues to orient you, but this can be trickier when you're just viewing a part of it on a photograph. Okay, so that's that. Now, let me rotate this bad boy around. Una más time. And once again, review. Iliopsoas. Well, actually, let me get my hand here the other direction. There we go. Better. Iliopsoas, right here, that little triangle. Pectineus, that little triangle. And this wedge right here, this little strange, distorted trapezoid or rhombus. This is called the adductor longus. Okay, as you might guess, the adductor longus is going to adduct the leg. So again, when you adduct the leg, let's just say you're standing balanced on one foot and your other leg is kicked out. You bring your other leg back, so you're now standing on 2 feet. You've just adducted your leg at the thigh joint. And of course, you kick it out laterally, straight out to the side, not to the front of you. If you kick out your leg to the front of you, technically you're flexing your thigh at the hip joint. Okay, so it's going to originate, pretty much on the pubic bone here, very near the symphysial joint or symphysis pubis. It's going to go down underneath everything to insert on the linea aspera or spiral line of the femur. And right next to the adductor longus, let's rotate this so you can actually see it. You see this tiny little thing right here, this tiny little sliver of muscle peeking out? That is the adductor magnus. And now you're thinking, wait a minute, that dinky little thing has the name Magnus? It sure doesn't look very magnum, as in big. What's up with that? Well, things can be deceiving when we're dealing with muscles. So let's pull our gracilis and sartorius off, and let's go to the side here and pull one of our hamstring muscles off. Okay, I gotta be careful that one of these is gonna fall on me. Okay, we're done. This, outside of the quads together, is the biggest muscle in the femoral region in the thigh. This whole daggone thing is the adductor magnus. Now we know why they call it magnus, because the thing is a monster. This is a huge, extensive muscle, like one of the biggest. But since it's covered up, it's buried by all these other strap-like muscles, the sartorius, gracilis, hammies. It doesn't look like it's that significant from the outside. Surprise, surprise. So this adductor magnus, where does it originate from? Basically, the ischial ramus on one, actually, you know what? Ischial ramus actually is best viewed here. Ischial ramus on one side, and pubic ramus on the other, and also the tuberosity of the ischium. Okay, where does it insert? Linea aspera, otherwise known as the spiral line, and medial supracondylar line of the linea aspera, that little part that branches off as we get to the distal end of the femur. And also that adductor tubercle that I pointed out when we covered the bones and kind of mentioned that adductor tubercle hanging out in that popliteal surface there all by itself, or popliteal fossa all by itself, is kind of important. Okay, it's called an adductor muscle. So obviously it adducts the entire leg at the thigh joint, but it will also flex and medially rotate the thigh, and the posterior portion of this muscle will do the opposite of that. It'll extend the thigh. So let's pull this off again. To a degree, actually, why don't we just completely pull all the hamstrings off and gluteus muscles off here. To a degree, this muscle here, and as you see, if this thing's a monster, it's freaking Godzilla huge. It's kind of like the trapezius or the deltoid of other body regions, in that it's so big and multifaceted that it can actually do opposing actions depending on which part of this muscle is contracting. Okay, so that's it for those. Now I need to put all these hamstrings back on. Why? Because I need to put a gluteus muscle on. So let's just rotate this around. Oh, stuff is going to hit the floor here and scratch my table while it's going to hit the floor. Double bad. Okay, so let's see. I'm hoping that's in focus. You know what? I'm looking at the camera and I don't like the focus. Okay, I guess that's okay. Not great, but okay. Let's see. Let's stick a butt cheek muscle on here. And actually, there we go. Proper way. Actually, what am I doing here? There we go. There we go. That tensor fasciae latae was sticking out. Okay, there's a bunch of these, not just the gluteus maximus, which you see. this gluteus maximus is going to originate on the ilium, sacrum, and coccyx. So rotate this around. Move that little dumbbell I have on the ground on the table here. So what do we have here? Ilium, sacrum, tailbone, coccyx. That's the origin of the gluteus maximus. Fibers are going to wrap around and down, and they're going to concentrate their force, their effort, on the gluteal tuberosity of the femur. And again, I pointed out that the importance of that gluteal tuberosity back when we were doing the bone labs. Okay, this is the major extensor of the leg at the thigh. It extends the entire lower extremity at the thigh. There's also some lateral rotation and abduction. You could argue this is the walking muscle, one of the major muscles that powers, walking. Okay, now I'm going to take a bunch of stuff off. Take the butt cheek muscle off, the gluteus maximus. Take the tensor fasciae latae off without having it land on me. There we go. Now, look at all these. OMG. Look at all these. This fan-shaped area up here, this is actually two muscles. They're depicted differently. Anteriorly, we have the gluteus medius. And then sort of on this side here, we have a gluteus minimus. Okay, so I have decent enough images of those on Canvas. Let us share the screen. Okay, so we're now sharing the screen here, and let's move down. Not that, that's mid-sagittal view, that's anterior. Here we go, right here. So basically, thigh worksheet 5 of 9. So this is a different brand model that you see photographed here. We have 2 of these in our lab, maybe 3. But they're old and very bad shape. They've been dropped a lot, fallen on the floor many times over the 40 or 50 years they've been in service in the district. But the original artist sculptor who modeled this, and off of which all these plastic casts have been made for sale, put this little groove here to highlight the boundary between the gluteus medius here and the gluteus minimus here. Okay, so that's why I deferred to this photo of this model. The one you saw I have on the table here in real life is just an off-brand model that costs like 1/6, 1/8 of what the Somso brand models cost. I don't know if you can even get the Somso brand stuff anymore. It's so insanely non-competitively priced nowadays. Anyway, so gluteus medius, where does it originate? On the lateral surface of the ilium and the iliac fossa, and we can see it in the iliac lines that we saw, the gluteal lines that we studied on the ilium, os coxa bone, in the bone labs. Now, it's going to sort of pass down here, and it's going to insert on the greater trochanter of the femur, but off to the side laterally. What does this little mid-grade, mid-sized, in-between gluteus muscle do? It's going to abduct. So you're standing, balancing on one foot, kick one of your legs out to the side, like you're doing one of those ballet dancers, or they used to make us do that in high school, just calisthenics, balance. Stuff's good for rock climbing, some martial arts, things like that. Dancers, I think, do this a lot. Anyway, so that's abduction of the entire leg at the thigh joint. It will also help medially rotate the entire leg at the thigh joint. Again, when you medially rotate your leg, you rotate your leg at the thigh so your feet are facing inwards. Now, this little dude here, the gluteus minimus. This will also originate on the lateral surface of the ilium, and it will also insert on the greater trochanter of the femur, but it goes to the front part, the anterior part of the greater trochanter of the femur. So it wraps around the insertion of the gluteus medius a bit. And it will also abduct and medially rotate the thigh. So these are tricky. The gluteus maximus has to be removed for this image here. Now, let's go ahead and we will get back to this shortly. Piriformis, gemellus superior, obturator internus, gemellus inferior, quadratus femoris. We'll get back to these shortly. What I want to deal with now are hamstrings, or hammies, as I call them. So first of all, let me click stop share here, and let's go back to this model here. Okay, so the nice thing about working with these models in real life here is that I can take the pieces off, and in a way, it's better than dealing with just a static two-dimensional photo in a book or on canvas. Okay, so let's get that centered there. So these are your hamstrings, posterior surface of the thigh. Pro tip for life, bro, don't pull them, don't tear them. If you pull them or tear them while you're working out, cycling, doing martial arts or something, running, guess who's gonna sit it out for a few months and ideally go see a sports medicine specialist and get yourself put back together. Having grown up before all of our spectacular modern technology, or a lot of our spectacular modern technology, when I was a kid, if you broke this stuff, you did not get healed, you did not get disability, you just had to go back to work and suffer for the rest of your life. The ability to repair sports injuries, athletic injuries, back then was not nearly as well developed as it is now. And if something happened, it was like, bro, take a chill pill for the next 3 months and take it easy on yourself. Your goals you had for yourself have just been eliminated, nuked. You're out. Okay, so biceps femoris is lateral. How do we know it's lateral here? Well, I see this big, whoops, wrong side of the camera here. I see this big iliotibial tract here. That's how I know it's lateral. I really suppose that the nice gentlemanly thing to do would be to put the gluteus maximus muscle back on there and slap a tensor fasciae latae up there as well. Since it's kind of important to orient ourselves to these landmarks on photographs, in textbooks, let's do that. Okay, so it's better to view this stuff with everything complete. So that way we can say, okay, yep, that's definitely the lateral side here, posterolateral. Now, straight posterior, biceps femoris. So like the biceps brachii, this muscle has 2 heads. And we can see that it originates, basically, a long head is going to go to the tuberosity of the ischium. The short head will go to the linea aspera and lateral supracondylar line of the femur. So the short head is going to be deep inside here and is really not even depicted on this particular plastic casting. So short head is going to go down in here. I mean, it truly is short. Okay, let's put this thing back on. So biceps femoris is lateral, it's off to the side. Exactly where is it gonna insert? Proximal head of the fibula. So that is way the heck down here. Let's tilt our camera down. So follow that biceps femoris all the way past the knee joint, all the way down below the proximal head of the femur. You can feel this little bump on yourselves, a little bump laterally off on the side of your knee joint, below a little bit, below the part of your shin bone where it expands, the tibia. And right here is the proximal head of the fibula. Also lateral epicondyle of the tibia, which is what that part of the fibula attaches to. What does this do? It's a thigh extender and leg flexor. So you kick the soccer ball with your quads, you extend your leg out, and then you bring your leg back because you're going to walk normally, run normally across the field chasing it. And that means you got to flex your leg back. Well, that's the biceps femoris helping you do that. It extends the lower extremity at the thigh, hip joint, but it can also act to flex the leg a little bit at your knee. Now, rotate this so we have a medial view here. I kind of need to drop this down. And I guess you can see this right here, this little sliver, and right here, this part here. This is another hamstring muscle that sits underneath this one on top. The one on top is the semitendinosus. The parts you can see of the one peeking out on the bottom, semimembranosus. Why do they call this the semitendinosus? Because of the total length of the muscle, half of it is tendon, and the other half is contractile portion. There we go. So let's pull these two muscles off. Again, it's dang things like that skull I had, the color-coded skull, that three-dimensional puzzle. Here we go. So semitendinosus is what you're looking at here. And on the other side, just laying right underneath it, is the semimembranosus. Notice that semitendinosus has its tendon here and contractile portion here, whereas membranosus, tendons up here, contractile portions down here. So tendon goes on top, sits on that flat membrane. That's how I used to remember the differences between these two as an undergrad. Okay, stick that bad boy, I'm sorry, those two bad boys back there, because there's two muscles. There's three hamstring muscles, biceps femoris, semitendinosus, semimembranosus. Okay, so where does this semitendinosus originate? Ischial tuberosity. Semimembranosus also originates on the ischial tuberosity or tuberosity of ischium. Semitendinosus wraps around, comes down, bypasses the tip of the femur, the distal end of the femur, goes all the way down to the knee joint. And it's basically going to insert on the medial side of the tibia past the knee. Semimembranosus underneath it goes to the medial epicondyle of tibia, but it will also attach a little bit to the femur and a lateral epicondyle of femur. So again, these attachments, they wrap around. Okay, what do? They both extend the thigh and they both flex the leg. Now, we got the big ones taken care of. Those little ones I talked about. Let's go back to sharing our screen on Canvas. Back to these. Okay, so we got the gluteus medius, gluteus minimus. Now we shall deal with the piriformis. Okay, so this piriformis muscle, where is it going to originate? Obviously, it originates on the sacrum, anterior and lateral sides. So on the inside, it passes through this greater sciatic notch. You remember all of these structures, and I hope you can see the cursor there because now it's showing up on my screen. You studied all these structures and features of the os coxa bone when we did the bone labs. And it's going to pass around and insert on the greater trochanter of the femur right here. It will rotate, I'm sorry, this is a tiny little thing of a muscle. It will help with a lot of other muscles involved, obviously. It will help to rotate the thigh, and it will also help to extend that thigh laterally. Really, you got to extend your thigh first and then you rotate it. So once again, complicated movements involved in walking, jogging, running, standing, maintaining your balance and coordination while you do all that. Next up, one of the twins, gemellus superior, this little wedge right here. Okay, origin here, spine of ischium, ischial spine. Insertion, follow that to the greater trochanter of the femur underneath here. This will help rotate the thigh. Obturator internus is this little one in between the two twins, gemellus superior, gemellus inferior. Obturator internus, it originates on the margins of the obturator foramen, that great big hole or opening in the os coxa bone. And what it's going to do is it's also going to rotate the thigh. And as you can totally see here, follow it all the way to its insertion. It's also going to insert on the greater trochanter of the femur. Now, gemellus inferior, this little angle right here, the gemellus inferior. Well, that's going to originate on the tuberosity of ischium. It'll insert on the greater trochanter of the femur. It will also help rotate the thigh. Notice that these all pull on the femur muscle and hence femur bone, and hence thigh from slightly different angles. So when they help rotate it, they're actually going to be pulling from slightly different directions, and that's going to have major consequences for our balance and our movement. Okay, now this one down here. It's a rectangle, has 4 sides. It's a quad, quadratus femoris. Don't get this confused with a quadratus lumborum, another one of those quadratus muscles. So quadratus femoris muscle, again, it's going to originate on the ischial tuberosity, that big rough textured growth on the bottom of the os coxa bone. It's going to go to the intertrochanteric crest between the greater trochanter of the femur and the lesser trochanter of the femur down here. Okay, so this will rotate the thigh outwards. Actually, all of these rotate the thigh outwards or laterally, but in the process of rotating the thigh, basically rotating your entire leg at the hip joint, so your feet are pointing outwards, it's also going to help stabilize the entire hip joint so other muscles can do their work. Okay, so that is pretty much it for all of these muscles here. We are pretty much done. A little bit of a pectineus peeking out here and a little bit of an adductor magnus peeking out from this angle with everything removed as well. Okay, so I got through the models here. Again, this is muscle video 7 of 8. I have to stop recording immediately because I've used way more bandwidth and I couldn't upload the